When you're planning to start with serious, I will say that first you want to start with ECG. That is for hyperkalemia, hypokalemia, hypercalcemia, and all those things. What are the ECG changes? Where do you expect QT prolongation? What all things, if you didn't learn, please just learn. What are the features in ECG you can see in hypokalemia? Hyperkalemia, very, very, very important. Okay, learn with that. ECGs very important, and also what ECG you can expect in PSVT, very, very important. Okay, very important. Then you want to look this thing, our JVP waves. There is a JVP A wave, C wave. What all were absent JVP? There is a constrictive pericarditis. What happens? There are key points. There is a chart and table. Please definitely learn. Then you come with murmurs. What murmur you can expect in aortic stenosis, tricuspid stenosis? Because 2023 there was a question, what is a murmur? They have just given a picture and asked, most of them were not knowing because they studied all the tough subjects, tough questions, and finally they asked a simple thing, you will not be knowing. So just study the murmurs. Which all murmurs? Just draw a picture and do it. Tachycardia, cardiopathy, all you know, Burger disease, that all MCQ wala, you can finish it with MCQs. And pansystolic murmur, where do you see, and all those things. And hypertension, actually just read and go. Hypertension, that very important. Hypertension is read and go, okay, because it's going to be very important. So which of the first line drug, where, what about in pulmonary edema, what happens and what do you expect in pulmonary edema, as well as the management. Last 2022 they have asked the questions regarding this pulmonary edema, very, very important. Hypertension connected with pulmonary edema, there's a question. Congestive heart failure, that you want to know which degree block, like primary block, secondary, third degree block. Just look it, okay. First degree block, that is what I just primary, first degree, second degree, third degree block, that just look at. Rheumatic heart disease is very simple, that all those criteria wala. Infective endocarditis, that raw sports, everything. Where do you see oscillars? Not just read it and go, that box is enough and more. Very, very important. Infective endocarditis, what about the treatment pattern? They will be asking like whether it is myocarditis, like how 5 years plus 10 years, or that they will definitely ask this time. Just think that they'll be going to ask it, just study it. And yes, multifocal atrial tachycardia is very important. That ECG wala, you'll be seeing there's a particular feature will be there. And yeah, cardiomyopathy, just read and go. So these are all this thing. It's very simple. JVP, don't never ever miss JVP. Okay, guys. So this is going to be as very, very important topics I have just completed. So this is very, very important topics, and this much topics you want to definitely study and go. And with addition to this, you want to add with doing MCQs. And if you read all those previous year questions and pile up with all your additional data, definitely you will rock this exam. And always I want to say that always stay away from peoples with negative mind and negative thoughts, because their aim is to just grab you with negative chinta and to put you in tick. So always remember one thing, we have time. Of course we have time. Every day I have got 24 hours, and it is what, how you use the time. So dreams are always big and they always have wings. How to use of that wings, just determination. So yes, of course, I am Dr. Amrita here, and if you guys want any mental strength and support, I am there till your examination, and I'm planning to bring with all other rest of the subjects also very quickly. And thank you all guys for listening me, and it's me, Dr. Amrita. Thank you all.